Greetings, this is Dr. Jess, and welcome to part 9 of the podcast Health Hacks with Dr. Jess. This is May, and it is Mental Health Month, and I decided to do a series of podcasts on the natural treatment of mental illness. Is it possible? Well, by the way, yes, it is. For those who are joining us for the first time, I'm Dr. Jess Armine. I have been a healthcare provider in one form or another for 50 years. I have multiple degrees, multiple certifications. I have the expertise in epigenetics, forensics, and so forth, as you can see. I'm known as the neurotransmitter whisperer and the Sherlock Holmes of chronic illness. And this month, the moniker the neurotransmitter whisperer will come into play. Why do I have a passion for mental illness? And I'm going to introduce you to my son, Jesse Armine. Jesse's a very singular individual. He's an Eagle Scout. He was director of a nature program at Rodney Scout Camp on the Chesapeake Bay for 6 years. He's earned all the highest awards as an adult scout leader. He has a Bachelor of Science in Environmental Sciences. He was published in a peer-reviewed scientific journal as an undergraduate. He's a graphic artist, full-time. He's a smart, funny, and an incredible lecturer. And my son Jesse was diagnosed with schizoaffective disorder, which is schizophrenia, at age 15. I noticed, as I'm sure you have, that people with mental illnesses are called very funny names: bonkers, retards, wackos, loco, thick, stupid, lazy. The fact is that these people have illnesses just like if you had diabetes or you had thyroid problems. They bleed just like you do. They're very talented. They're very kind and caring, but because of these attitudes by practitioners especially and the general public, they tend to suffer in silence. And the pictures you're seeing here is of Jesse leading scouts on a bay hike inside the Chesapeake Bay. Mental illnesses, just by definition, are called many different things: major depressive disorders, bipolar disorder, seasonal affective disorders, disruptive mood dysregulation disorder, persistent depressive disorders, premenstrual syndromes, OCD, ODD, oppositional defiance disorder, ADD, ADHD. But mental illness can be caused by medications, drugs, substances, or medical condition or illness. For instance, chronic illness or cancer can lead to mood disorders or mental illness, as can alcohol or substance abuse disorder, actually alcohol use disorder, or exposure to certain drugs and toxins, and this is often ignored. Understand that mental illnesses are multifactorial. The symptoms that are expressed as mental illness have their origins in both psychological and physiological areas. Understand that when you have these issues, it doesn't matter which came first, the chicken or the egg. Both ends of the spectrum have to be treated. And almost always, the physiologic causation and manifestations are not adequately considered or treated. This is the stone that's been left unturned in the treatment of mental illness. Very often you get medications that work on receptors and so forth, but your ability to create neurotransmitters to recreate the balance is never attended to or not attended to adequately. So over the next few weeks, I'm going to introduce you to the physiologic considerations and treatments that can be done naturally and may be the stone that's been left unturned for your loved one. Please know that the same factors that damage the cell are what create mental illness and other chronic illnesses: chemical and physical, microbial, and all the psychological, emotional, and spiritual traumas that we have experienced or that we face on a regular basis. This was the cell danger response we talked about several podcasts ago, and for those people who are on my YouTube channel, you can go back and review it fully. For definition, depression is a state of low mood and aversion to activities that can affect a person's thoughts. People with depression can feel sad, anxious, empty, hopeless, helpless, worthless, guilty, irritable, or restlessness. Okay? They may lose interest in activities that were once pleasurable. Anxiety is characterized by an unpleasant state of inner turmoil, and we've all had to one degree or another where it's kind of really nervous on the inside and you're shaking and you want to pace back and forth. You have kind of body complaints. You may ruminate on different things and not be able to get thoughts out of your mind. Okay, this is anxiety, but remember that depression and anxiety and all the other psychological manifestations are expressions of your neurotransmitter balance. The term neurotransmitter is often bandied about, but what are they? How do they affect your mental state? Well, here goes. Neurotransmitters are chemicals that literally transmit neural impulses along the nerves. Now, nerves are not adhered to, they're not in a big long line. There's clefts in between, which are called synapses. So what the neurotransmitters do, you can see in the illustration, is they release these little neurotransmitters, these little chemicals, which look like little cherries here, that go to the other side to the receptors and continue the particular message that's going along the nerve. And this is very necessary, and a certain amount of it and a certain balance is very necessary for normal neurological and mental function. So, neurotransmitters are generally divided into excitatory and inhibitory. Inhibitory is things that calm you down, allow you to go to sleep, and so forth. Excitatory are those things that wake you up, give you the ability to focus, and so forth. Excitatory neurotransmitters are things like adrenaline, which is also known as epinephrine, noradrenaline, which is also known as norepinephrine. And when this is high, you can have anxiety, tremors. Just think about having too much adrenaline, anxiety, irritability. When it's low, fatigue, low energy, low focus, low mood. Dopamine, when it's low, you can have a kind of bipolar depression, which is the hallmark of it is a lack of joy. When it's high, you can have a whole mess of different symptoms like psychosis, cell death, cravings, developmental delay, poor intestinal function. Glutamate, when it's high, you can have brain damage. When it's very high, seizures, okay, cell death. Phenylethylamine, PEA, when it's low, low focus, low attention, ADD. As a matter of fact, norepinephrine and phenylethylamine are responsible for a lot of ADD, ADHD, a lack of ability to focus. There's other reasons for it also, but when it's just this, it's comparatively easy to fix. That's why some of the ADD medicines seem to work, because some of them stimulate the adrenal gland, which is going to release norepinephrine and bring that neurotransmitter up to the point that the child is able to focus again. When phenylethylamine is high, you can have your mind running and anxiety. This is the kind of thing that is high when you're trying to go to sleep and your mind is racing. The inhibitory neurotransmitters, the bigger ones, are serotonin and GABA. Serotonin, when it's low, typically anxiety, insomnia, depression, uncontrolled appetite, unexplained gastrointestinal symptoms. Why? Because we have a central nervous system, a peripheral nervous system, and we also have an enteric nervous system, which is what runs your GI tract, and the major neurotransmitter there is serotonin. GABA I'll explain on one of the next slides. This is the brain wall. This is a cooperative effort from my son Jesse, who digitalized it, and I actually created it. And this is based on information that was given to us by my son's preeminent psychiatrist, Dr. Liz Stuller in Baltimore. And what it does, and I'm going to show you in the successive slides, it shows you the areas of the brain involved, what the function and dysfunction looks like, and what neurotransmitters are primary there. You can actually get this at those two links on the bottom, or you can email me, and I'll give you the links. These are available commercially. Let's talk about the prefrontal cortex. Okay, ADD, ADHD lives here. Its function is attention, judgment, impulse control, critical thinking, and it grows until age 25. When it's in dysfunction, it's distractibility, impulsivity, poor judgment, laziness, tardiness, and everything one calls a teenager. You ever wonder why a teenager, when they do stuff and you ask them, why did you do that? And they say, I don't know. Well, it's because their prefrontal cortex, their executive function, hasn't really matured yet. Okay, dopamine, epinephrine, and norepinephrine are the guys that run this area. The anterior cingulate, this is where OCD and ODD, oppositional defiance disorder, live. This is your gear shifter, your cognitive flexibility, adaptability, moving from one idea to the next. When it's dysfunctional, stubbornness, holding grudges, obsessions, compulsions, addictions, and so forth. And serotonin is the guy that runs this. Think about it. All those dysfunctional things are excitatory. Serotonin is inhibitory and calms it down. The basal ganglia is where anxiety lives, and we have kind of two different types of anxiety. The internal anxiety, where you have those horrible feelings inside of you, and external anxiety, where you're yelling, screaming, and so forth. The guy who runs this area is GABA. Gamma-aminobutyric acid is the chief inhibitory neurotransmitter that calms your brain. If you have enough of it, just look at the top of the graphic. You're calm and able to sleep. If you don't have enough, anxiety, insomnia, tremors. Now, what's usually given to raise GABA are things like benzodiazepines, Xanax, Klonopin, Ativan, and the like. And people who drink alcohol and they feel good, it's because of release of GABA. Well, the mechanism of that is that it stimulates the GABA A receptor, which you see on the left-hand side there. And the problem with this is that when that's stimulated, those things that stimulate it are like those McDonald's off the highway, fast on, fast off. Okay, and that's why it's got the addictive quality because you need more and more and more to get enough GABA. What can be done with that really is these days is with liposomal GABA, which is commercially available. It mimics natural GABA. It's non-addictive, and it will supply your brain with GABA without overstimulating the GABA A receptor. The thalamic limbic system. This is where depression lives. This is where your emotional filter is, where you tag your emotions, your libido, appetite, and so forth. Serotonin is what runs this, and that's why serotonin will correct depression sometimes, appetite or sleep problems, decrease sex drive, and so forth. And your temporal lobe, which is at the floor of the brain. The left side is your more logical processing language, long-term memory, so forth and so on. The right side is more artsy, if you will, facial recognition, decoding vocal inflections, rhythm, and music. When it's dysfunctional on the left side, you have aggression, fighting, sensitive to slights, difficulty finding words, and the right side, which is kind of nasty, difficulty interpreting faces, trouble decoding voices, social skill trouble. Now, I think it's common knowledge that if you have an abusive parent, an abusive person, you tend to create abusive children. Now, why is that? Well, if you're a right-handed person, which most people are, and you strike your child a lot, you tend to strike them on the left side of the head, with your right hand. And over time, this creates a relative dysfunction in the left temporal lobe, which gives rise to aggression, fighting, and so forth. Just to tell you what the mechanism of it is. Another thing you have to remember, and this is why we talked about fundamental treatment previously, is that neurotransmitters are stored in these little things called vesicles, okay? And your membrane stability is necessary for proper neurotransmitters. So, when you have leaky cells and a leaky gut, you're going to have a leaky blood-brain barrier, leaky mitochondria, leaky cells. And I'd pay close attention to that because this is one of the things that can be a game changer if you do the fundamental treatment and take care of somebody's basic cellular needs. Many of these things begin to come into focus, come into normalcy, um, and I've seen this happen time and time again. So, I've been trying to keep this down to 10 to 15 minutes in little bite-sized pieces. So next week, I'm going to tell you how neurodepletion happens. I have an animation and what it does to your psychological health. Again, we'll go over what causes neurotransmitters to become imbalanced, what testing is available for this, a reminder of the neuroendoimmune supersystem, and the effects of emotional trauma. Okay, I really would like you to, I invite you to tell your friends about my YouTube channel, especially this month because mental illness is rampant. It's hidden, but it's rampant. Many families are suffering, and they should know that they have more options. Questions can be emailed to me at drjess.com. If somebody would like to know if I can help them, they can book a free 30-minute Zoom conference at my website. And again, the reason you want to treat with me is because I'm very well educated with 5 decades of experience. And when it concerns this area, I have, for obvious reasons, a passion for this. I learned all this stuff to help my son Jesse. I love him to death. I hold him in awe because he's a really special person. I love all my sons and I like all my sons. Okay, but Jesse has overcome many, many, many obstacles in his life. So if you have someone in your family or yourself that is experiencing any aspect of mental illness and you haven't been able to adequately resolve it or manage it, that would be a time to talk to me. This is something that I know an awful lot about. I'm incredibly well experienced with it. And frankly, people, I'm not an idiot. When someone needs medications, we utilize the medications. If they need medications and they need my care, I work cooperatively with other doctors. Okay, I don't stand on a soapbox and say, you must do this and you must do that. Yeah, I'm the guy that actually can put things together. And I'll give you the time and empathy you need. And as always, if no one tells you they love you today, remember Dr. Jess does. I'll see you next week.